Well, Dr. Ben Wyant from InMotion Pain Solutions is back, and this is the first time you've sat, isn't it?
Yes, we've been upgraded to chairs.
You've been upgraded to chairs. Well, I would feel a little short standing next to you two over here.
Well,
so,
we're vertically gifted.
You are vertically gifted. So there's two of you here today. Yeah,
yes.
So Dr. Haden Hammel, you're a new addition to InMotion Pain Solutions. So, yeah.
Absolutely. I'm from Waukon, Iowa originally. I was practicing in North Liberty first, and then Dr. Ben and I met up, and I've been at his office since the first of the year, and I've enjoyed every second of it so far.
Go on.
Go on.
It's been great. Dr. Ben has taught me so much, especially working with the Packers. I've learned a lot about different adjusting techniques and ways that we can really help people with that full spectrum care that we've been talking about.
I feel like we could do a whole segment about you working with the Packers as well.
That would be fun.
That would be fun.
Good stories.
Because I am a Packers fan, so I know.
I say we both happen to be Vikings fans, so.
Okay, well, that's another story. Yeah, we can just argue about that.
Will you still associate with us publicly?
Yes, absolutely. 100%, yeah. And you played football as well, is that correct?
I did in high school, not in college, but I have had enough days of my bumps and bruises to keep me in a chiropractor's office pretty consistently.
Right.
Yeah.
So, well, I get that, yeah, because you get all those, bumps and bruises and aches and pains when you're younger, and you just blow it off as you get older. It's not that easy anymore.
No, the bill comes due.
Yeah. So when you talk about, full spectrum of care, can you tell us what that means?
Yeah. When we had first opened the office, the intent was to treat primarily chronic patients. So these were individuals who were in so tough a shape they didn't have a quality of life. And there were a lot of people who came to visit with us that were not bad enough to need what I did. We wanted to treat appropriately, not over-treat, so we would refer those individuals to the appropriate practitioner. And what they really needed majority of the time was a good chiropractor. So instead of sending people away, we decided to hire a good chiropractor.
Yeah, absolutely.
Go on.
Yeah, there it is. So when we look at these spectrum, we see a lot of scenarios where we'll have little problems that require little fixes, and if we can treat somebody appropriately at that stage, we don't have to escalate to where it becomes a big problem needing a big fix. So bringing Haden in allowed us to treat that entire population of patients and be able to tailor care to what it was that they needed individually.
Okay. Do you see a lot of patients come in who, this could have been handled a long time ago and he wouldn't be this bad, but they wait and wait and wait because they think it's going to get better?
What do you know, Chris?
Me.
Yes, but all the time. And there's a lot of people who have been familiar with our office for a long time, years even, before we get to meet them for that first time. And unfortunately, that is the conversation many times, especially with extremity joints, shoulders, hips, knees. Time really is a factor in those scenarios.
It is, yes. So how does someone know who to book an appointment with?
Well, the beauty of that is you don't have to know. We always carry out a no-cost consultation, and that's where we gather the history. So Haden or myself carry out that service, and we get people in as rapidly as we can, just depending on whose schedule is more immediately open.
Okay.
And because it's a small office, we're in constant communication. So we have the opportunity to review every patient's history, and from that point we can make the determination of which of us is the more appropriate practitioner, and then we set up that report for the patient, which with one of us is going to be that provider. Okay.
So I understand there's another benefit to seeing Dr. Haden.
So with me, I use a few different technologies, but also specialties that Dr. Ben doesn't always utilize. He's got the big fixes. I focus on those smaller fixes. Maybe it's uncomfortable sitting at your kid's game, or you sprained your back on the golf course. Those are things that I love to take care of and get people back to living that everyday life without letting it escalate into those big problems that Mr. Ben has to take care of.
That's right. You see Haden, so you don't have to see me.
Okay.
Let that be known.
Because I know a lot of people, they just say, oh, I hurt my ankle. I do. I hurt my back, just swinging too hard on the golf course, and it'll go away. It'll get better.
Until it doesn't.
Exactly, and then you hurt something else because you're overcompensating. I'm guessing that happens a lot too. So both of you can kind of help out with that.
Yes.
Okay. Now we also want to talk about the first step, of course, is the no-cost consultation, which is awesome.
Yeah.
Yeah, tell us about that. There you go. You're on the spot.
Take it away,
what you got?
Come on in, and we sit down. I've been doing a lot of them lately. I love doing it. Sit down. You get a little bit about the person's background. It's not just about your pain. It's about your life. What are you doing?
Right.
Are you retired? Are you working? Are you traveling? Because all those things are going to have an impact on what your pain is going to present as. You know, people that are working those labor jobs, they're going to have that deep-seated back pain, and we really want to help them before it gets to a point where surgical intervention is, you know, on the horizon
Right.
for them.
Nobody wants surgery. I mean, let's be honest.
If we can avoid it.
Yeah, if you can avoid it, yeah.
But the beauty of the consultation is if somebody comes and they've waited too long, or their condition is just at that level of severity where the options that are necessary for them to find relief are not within our office, we can educate them on that, and we can get them in the right direction. So the
Well, that's great.
consultation allows us to provide that education so that they are informed enough to make their best decisions.
Okay. And where can people get more information?
Best way to get in touch with us is to call the office, 319-200-1495, or you go to our website, iowapainsolver.com. You can request a consultation at the website. We also have a no-cost webinar where I talk through the big three. Why are you hurting? Why have the approaches previous not been successful for you? What do we do that's different?
Okay.
And soon we'll be able to expand that to how does Haden make it so that I don't have to work so hard, because we're getting people taken care of before they get in ugly shape.
Yeah, that's great. And I feel like you're talking to me right now. Yeah, I need to get in. I know. I'm a mess. All right. I want to thank you both so much for being here and welcome aboard.
Absolutely. Thanks for having us.
All
Yeah, it's
right.
been
We'll have
fun.
to talk about the Packers and the Vikings someday.
Next time.
Next time.